Headache is experienced by all of us. The most common one, which every one of us has experienced, is tension headache. Now, the name itself tells what is tension headache. It occurs because of stress and tension. So, this kind of headache, you feel a dull, aching type sensation on your head, and you feel like there is a tight band around your skull. The tender point of this kind of headache is the posterior side of your neck on your suboccipital region. So, yes, women are affected more with this tension kind of headache. Now, what are the causes of this headache? So, stress being on the top. As the name itself tells, tension headache. So, obviously, tension gives you tension kind of headache. So, do not take stress for this. Stress is one thing. Inadequate sleep. If you do not sleep properly, most of us have experienced this for sure. After waking up, you feel the tightness aching on your head, especially on the posterior side of your neck. So, inadequate sleep is also one of the reasons for tension headache. And the most commonly, poor posture. So this is important because as we tend to use a lot of phone these days and work on computers, we continuously gaze down, keeping our neck in a forward posture. We call this as forward neck posture. So you keep your neck in a forward posture and gaze down and continuously use your tablets and phones while playing games or be it any kind of work. Now this puts on a stress on your suboccipital muscles. So there is tenderness on your suboccipital region, posterior side of your neck, upper trapezius, and also on the scalp. Now, tension headache is often confused with migraine, as these two kinds of headache, it comes with similar kind of characteristics. But one major, okay, migraine, it comes with nausea and vomiting also. But the major difference between the two is migraine has photophobia and phonophobia, which means when you are having migraine headache, you cannot tolerate bright light and loud sounds. So photo is the light, phobia is the fear. Same goes with phonophobia, the fear of the sound. So migraine comes with photophobia and phonophobia, whereas the intensity of the headache, of tension headache, it remains the same with the bright light and loud sound. So that is the major difference between the two. Also, tension headache can be mild to moderate, but it doesn't increase or decrease its intensity with the daily activities, which means when you are having this tension headache and when you start to do something, some of the activities, that activities will not increase or decrease the intensity of your tension headache. It remains the same. But in migraine, with the work, the intensities it differs. So that is the major difference between tension headache and migraine. Now another thing that has to be clear is headaches should not be neglected because headache can be primary and secondary. Now primary kind of headache, which includes a tension headache and migraine, are the kind of headaches are, you can say, the purest form of headache, which means it does not have any other cause by which the headache is occurring. The headache is there because of the headache itself. Now, the secondary kind of headache is you get the headache because of other problems. So, you can have the ache because of brain tumors, cervicogenic pain, and headache after a fall, injury, or trauma. So, no headache can be has to be neglected, especially when your headache is associated with speech impairments, vision disturbances, cognitive impairments, vomiting, syncope, or fainting. So, if your headache is associated with all these, early clinical intervention is important. So this was all about tension headache. One more thing, tension headache can be episodic and or chronic. Episodic headaches are once you start with the headache, that can last for few minutes to 1 week. Now when you are having frequent episodic headaches, which is which occurs for more than 15 days in a month, that continues for 3 months, it turns to your chronic kind of tension headache. So this was all about briefly about what the tension headache is all about. Now let us know what we can do to treat this tension headache. So the first and the foremost thing is stress. Do not take stress. My favorite word being stress. I'll be making a video on this topic itself soon. So yes, stress. Do not take stress at all. Next thing is sleep properly, eat properly, have adequate sleep. Sleeping is very important for a healthy mind and a healthy body. So sleeping is important. Now, poor posture. Try to maintain the good posture. Now, for relaxation of tension headache, what you can do is, I will be demonstrating some of the exercises, 2 or 3 exercises, which you can do by sitting anywhere or just by standing also. Now, trust me, that will give you a lot of relaxation. The first thing, what you can do is just tilt your neck sideways. You get a stretch here. Now, to enhance that stretch more, the opposite hand has to be taken back. Yes, I can feel the more of stretch now. So hold this position for 20 seconds and then come back. See, I feel relaxed even with the hold of 2 to 3 seconds only. So you can hold that for 15 to 20 seconds and come back. Repeat the same on the opposite side also. Do not do it on one side only. That will not work. So do it on both the sides. The next thing what you can do is look down, turn, look down again. So you feel a stretch slightly below, and to enhance the stretch, pull your head with your hand down. You get more of the stretch. Hold the same thing for 20 seconds. Do it bilaterally on both the sides. So this was number 2, and I'll not tell you all more exercises as I know that more will as I give you more, you will not tend to do it and it makes you feel lazy. The last one, which is the easiest one, just sit or stand straight, whatever you're comfortable in. Your chin has to be tucked in. Now, while doing this, it is important you don't have to go back or move forward. Be relaxed in your normal posture, whatever your posture is. Just take your chin down and back. Now that gives a stress here on posterior side of your neck, and then hold that again and you can leave that. It gives you a lot of relaxation. So these 3 exercises is very easy, very common. You can do this to relieve your stress on your neck muscles, relieve yourself from tension headache. Do not forget, sleep is important. Not taking stress is also important. But of course, not neglecting headache is also very, very important. So I think this is clear what you can do to relieve yourself from tension headache. If do practice this. If it helps, you can like, share and leave your feedback on the comment section. We will meet on the next video with another problem and its treatment also. Bye-bye.